tonight is the Mikulski Amendment that has to do with breast cancer screening and other preventive services for women. Senator Mikulski and I have worked together on women's health issues for a long time in this body. 2 years ago, we championed the reauthorization of the National Breast and Cervical Cancer Early Detection Program, which provides screening and diagnostic services. So we know how important it is to address women's health care issues. And I was in complete disagreement with this new task force recommendation on mammograms and the need for mammograms for women under the age of 50. But I am very concerned that with the recent recommendations of the task force and how this health care bill that's before us relies on the task force, that the amendment is not going to do anything that solves that problem. The health care reform bill relies on the task force 14 times, and it even allocates money to pay for advertising the task force recommendations. But this amendment does not address the problem. Rather than severing the ties with that task force so that it will not become the norm, the amendment now allows yet another government agency, the Health Resources and Services Administration, to interfere with the relationship between a woman and her doctor. So now, coverage decisions will be dictated by both the task force and the Health Resources and Services Administration. So instead of letting doctors and their patients make the decision about when a woman needs a mammogram, we have now not one government task force, but two that we will have to have intervene in that decision. Oh my gosh, Mr. President, that does not make any kind of common sense. While I agree with Senator Mikulski about this great importance of preventive care for women, I disagree with this approach because it still injects a government agency or task force into the decision that is going to determine whether women have access, easy access, full access to the health care of their choice. The second item that we will be